Dear students, today we will discuss about analgesics. First of all, let we know what is analgesics. Analgesics are the drugs. Analgesics are the drugs which relieve pain. Analgesics are the drugs which relieve pain. Now, what is pain? Pain is unpleasant sensation. Any unpleasant sensation we don't prefer. Pain is unpleasant sensation. So if we want to define analgesic, how we will define analgesic? Analgesics are the drug which relieve pain without altering consciousness. So this is about definition of analgesics. Now let we know what are the types of analgesics. There are two types of analgesics. Centrally acting analgesics, which are called opioids, and peripherally acting analgesics are called NSAIDs. NSAID, non-steroidal anti-inflammatory drugs. So let me know how these things are classified. This is our brain. So this is suppose an organ or liver or skin or any place. These are the organ. So when anything happen, any damage or any infection or anything happen to these organs, then this information will move to the brain through the sensory nerve. There are another types of nerves which bring information from brain to the organ, which is called motor nerve. So here the source of pain source is suppose an organ or tissue. Then this pain sensory information as a current impulse will move to our brain, and in that brain recognize this pain. So these opioids will block these sensory nerves. Opioids will block the sensory nerves here in the brain. That's why they are called centrally acting analgesics. And here these are the pain causing agents, pain mediators. Or they are inflammatory mediator. Mainly these are prostaglandins, which are released during the damage or injury to an organ. These things which cause the pain. So these NSAIDs work to inhibit the prostaglandin formation. That's why they are called peripherally acting. In the next, we will discuss in the details the mechanism of these prostaglandin inhibition and nerve inhibition. Now look at to the classification first. This centrally acting analgesic which block the sensory information or to receive in the brain are mainly classified to three categories: natural, which are morphine or codeine. Codeine, they are natural. Next class is semi-synthetic, which are modified version of natural, which are semi-synthetic. In the laboratory they are modified the natural one. And which are hydromorphone, oxymorphone. Synthetic, which are completely synthetic, which are not natural source. All the natural source of morphine and codeine are opium. We all know that opium is a narcotic. Plants from their morphine, codeine are received, and these are modified version. Synthetic are pethidine, tramadol and methadone. These are centrally acting opioids, or they are called narcotic analgesic. Narcotic analgesic, they are physically dependent, they cause abuse in people, so they are called narcotic analgesics. But there are some uses of this type of analgesics are there as a in medicines. Mainly they are used in severe pain, in case of severe pain which may be myocardial infarction in the heart myocardial infarction, heart failure when occur, myocardial infarction will occur, then it use in fracture, in the fracture of long bone, when more pain is there, long bones, burns, when any burns occurs, during the burns, cancer, and obstetric labor pain, operative, during the operations, surgical operation pain. This type of, in case there severe pain when occurs, this type of narcotic analgesics are given. Next we will discuss about peripheral acting analgesics. Peripheral acting analgesics, which are called non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. Non-steroidal, because these are not steroidal, like this morphine, codeine, hydroxymorphine, which are centrally acting, they are steroid type in nature. So these are non-steroidal anti-inflammatory drugs. Anti-inflammatory, they also produce anti-inflammation, they decrease the inflammation, swelling of any organ, swelling or redness, pain. We will discuss in later what are inflammation. They are non-selective COX inhibitor. We will discuss in this prostaglandin, how these prostaglandins are released. There are two types of enzyme, COX-1 and COX-2 enzyme, which convert arachidonic acid 1 arachidonic acid to prostaglandin. These enzymes are blocked by these NSAIDs. Non-selective, which block both COX-1 and COX-2 enzyme, which are called aspirin, ibuprofen, diclofenac, mefenamic acid. These are non-selective COX-1 and COX-2 inhibitor. Second one, preferential COX-2 inhibitor. They inhibit COX-1 also, but more they inhibit COX-2. They are called preferential COX-2 inhibitor. Meloxicam is an example. Next is highly selective COX-2 inhibitor, COX-2, which is highly selective, like celecoxib, rofecoxib. They are highly selective COX-2 inhibitor. There are certain analgesic are there, NSAIDs, which also reduce the fever. Analgesic and antipyretic, most commonly used is a paracetamol. So these are NSAIDs, non-steroidal anti-inflammatory drugs. What are their uses? Commonly they are uses in our less severe pain, visceral pain, in any type of infection or injury. Next, these are used like musculoskeletal, in our muscle or bone, musculoskeletal pain, headache, toothache, in our headache if happen, and mild migraine, menorrhea during the problems in menstruation cycle, pain in menses, dysmenorrhea, like this osteoarthritis, gout. These are the common visceral pain, which pain in some organ or in our body, like infection, injury, if anywhere happen, then the pain, to reduce this pain, NSAID is given. Musculoskeletal pain, muscle and our joints, bones, then it is given. Headache, toothache, in our tooth pain occurs, like mild migraine, also dysmenorrhea. In the menstruation, not regular mens occurs in female. Osteoarthritis, in the bone, arthritis, joint pain, then gout also, some joint pain. These different types of common, which are not severe pain, their NSAIDs are given. Now we will discuss the mechanism of action of this opioid analgesic, mechanism of action of opioid analgesic, and next we will discuss mechanism of NSAIDs. These opioid analgesics, already we discussed. Suppose this is an organ, and through this nerve terminal, and this is the brain neuron, brain in suppose neuron. Here in this part of the brain, there are three types of opioid receptors are present, and also presynaptic neuron also. This is the sensory neuron, which carries the pain information, pain impulse. Suppose here pain occur, pain. This pain information will travel through the sensory nerve, and this is the presynaptic. This is a gap is called presynaptic neuron, and in this is called postsynaptic neurons in the nerves in our brain. There are three types of opioid receptors are present: mu, delta, and kappa. Mu, delta, and kappa. These opioids, morphine types of drug, morphine, codeine, or these narcotic analgesic, they bind with these opioid receptors. They bind with opioid receptors. What are the receptors? Mu, delta, and kappa, opioid receptor, and inhibit neuronal activity. This is the main mechanism. Now we will discuss in somewhat details how this inhibit in the neuronal mechanism, neuronal activity. Suppose this is in the bigger picture we are drawing. How this is the nerve terminal, the same terminal. When impulse, pain impulse will travel through this nerve, and they will reach here, and after reaching this pain impulse, then there will be the influx at the axonal terminal. This pain impulse, due to this current, they will activate one enzyme which is called adenylate cyclase. Adenylate cyclase enzyme, or it is called ACE, simple ACE. Normally what happens, these pain impulses will activate this adenylate cyclase, and calcium influx will occur. Calcium ion enter inside the cell. So inside the calcium level will increase. When this calcium level will increase, they will release neurotransmitter. It is called glutamate, and this glutamate in this region, postsynaptic region in the neuron, postsynaptic this glutamate will bind to their receptor, and similarly they will cause efflux. They will activate adenylate cyclase also here and remove potassium ion. They will, this impulse, they will influx namely calcium ions, and other calcium ion influx, the calcium ions will come, influx calcium ions will enter, and in this action potential increases and neuronal activity will increases. Not only the calcium ion, some other positive ion also enters like sodium, like this positive ions enter, and the action potential neuronal activity will increases, and the brain will recognize this is as a pain. Now what is the pain this opioid will do? This opioid will bind this the opioid receptor. Opioid receptor. When this opioid will bind, this is suppose opioid, morphine or any opioid will bind, they will inhibit, opioid will inhibit adenylate cyclase. What? In the presynaptic neuron, they will inhibit this adenylate cyclase. If this is inhibited, they will block the calcium influx. Then finally, this release of neurotransmitter also block. That do in presynaptic neuron. So opioid are the agonist. Opioids are agonist of opioid receptor. They are agonists. They bind. After binding, they inhibit adenylate cyclase. After adenylate cyclase, if it is inhibited, then though pain impulses is coming, but calcium is not entering to the presynaptic neurons, and so neurotransmitter are not released. If neurotransmitter are not released, then pain will not recorded in the brain, so brain will not feel the pain, though organ having the pain sensation is there. Similarly, in the postsynaptic neuron, opioid receptor, the opioids will bind and they will inhibit this adenylate cyclase, and they will cause efflux of potassium ion. Potassium ions will move from cell to outside the neuron. When the potassium ion will move out from the neuron, then action positive charge will decrease in the neuron and action potential will decrease. Like this, neuronal activity will decrease the neuronal activity. So this is the mechanism of opioid. All the opioids are narcotic analgesics. This is the mechanism how this happens. Now we will discuss the mechanism of NSAIDs, non-steroidal anti-inflammatory drugs. We already know that they inhibit, they block the COX enzyme. How this happen? Suppose this is an organ, they are made up of cell. When there will be the damage, then there will be the cell membrane. What happened? Cell membrane. This is the cell membrane, phospholipid bilayer membrane. We know that cell membrane are, cell damage means membrane will release. We know that this cell membrane are made up of phospholipids. So what happened? Anywhere any damage will occur, then phospholipids will release. So when these phospholipids are released, then one enzyme present in our tissue which is called phospholipase A2 enzyme. These phospholipids are converted to arachidonic acid. Arachidonic acid. And this arachidonic acid is converted to two types of enzymes which is called LOX enzyme and COX enzyme. COX are two types, COX1 and COX2. COX1 mainly present in our gut, GIT tract and other tissue. COX2 mainly inflammatory sites and also in kidney. COX. What is the full form of COX? Cyclooxygenase. LOX, lipooxygenase. This is the enzyme, cyclooxygenase or lipooxygenase. What happens? This arachidonic acid is converted by COX enzyme to prostaglandin. Different type of prostaglandin, prostaglandin D2, prostaglandin E2, prostaglandin A, this type, different types of prostaglandin. And these prostaglandins are main responsible for pain. They cause the pain sensation in organ, and whose pain is recorded to the brain. Now NSAIDs, this NSAIDs, non-steroidal anti-inflammatory drug, whatever we discuss, aspirin, diclofenac, mefenamic acid, all, paracetamol, all, they will block NSAIDs. They will block this COX enzyme, so that arachidonic acid will not convert it to prostaglandin. This is the mechanism of NSAIDs. I think you have understood. This is very easy mechanism. Then narcotic analgesics. Now we will discuss about what are the side effects of these types of analgesics. The most common side effects we have observed in the opioid analgesics, they cause CNS depressant, euphoria, abuse, physical dependence, their physical dependence. They decrease immunity, respiratory depression, These are the main, and also hypotension. These are the main problem caused by opioid analgesics. Whereas NSAIDs, the side effects, these are the side effects. Main side effect in our GIT, which cause gastric ulcer, GI bleeding and hyperacidity. In CVS, cardiovascular system, they can cause hypertension, congestive heart failure, etc. In organ, mainly in the kidney, this NSAID is called nephritis, kidney problem, sodium retention, more sodium will retain, sodium retention, and due to the more sodium retention, hypertension, high blood pressure also occurs, and more chronic kidney failure. These are the common problems with NSAIDs, mainly GIT, gastric ulcer, GI bleeding, indigestion, like these problems will occur, cardiovascular system, and decrease platelet count, and increase risk of bleeding. So these are the side effects of